CGTN, China Global Television Network.
Faced with the new realities of social isolation and massive job losses in the midst of a global health emergency, millions of people across the globe are struggling to adapt and have slipped into anxiety, fear, anger, and depression. Healthcare professionals and researchers have recorded spikes in mental health problems since the outbreak of COVID-19. The World Health Organization says that fear, worry, and stress are normal human responses to perceived or real threats, such as the coronavirus pandemic, which the world has battled for nearly 2 years. Experts now warn that there could be a looming mental health crisis, which could linger on long after the pandemic. So what impact has COVID-19 had on the mental well-being of people, particularly here in Africa? And what interventions can be put in place to prevent another potential health crisis? I'm Beatrice Marshall. Welcome to Talk Africa. A scarcity of research mirrors the weakness of mental health services in Africa, and the blind eye turned to the problem by many Africans and their governments. End quote. That is according to the Lancet Global Health Medical Journal. In many parts of the continent, conversations on mental health remain either a taboo topic or still largely misunderstood. We sampled views from various cities in Africa on this subject, and this is what Africans had to say.
Well, in Zimbabwe, there's still a taboo topic. It's not discussed openly because mental health is associated with stigma. So the moment you start talking about it, or the moment you reveal that you're suffering from mental health, you're stigmatized.
Definitely with my age group. And just because I've been through mental health issues, quite severe ones, I'm more open to talking about it with people. So I think that with certain people, there's more open conversation than with others.
I believe the elderly are the most affected. In addition to the diseases they have, they developed psychological issues. My grandfather's joy in life was to pray at mosque. When the mosques locked down, he started showing signs of depression. He was already diabetic and hypertensive. We started noticing that his blood sugar levels were becoming higher and his blood pressure increasing even more.
There are children who found themselves in a situation where COVID-19 cases were reported in their school. That created anxiety among them. The school had to be closed and many children experienced stress. It was a difficult moment for those who were not mentally strong.
I find it very hard to cope with the magnitude of misinformation and bad news. As an elderly, I applied for the vaccine. By the time my appointment came, I got surrounded by information about how unsafe the vaccine is and the health problems it could cause. That makes me confused and always tensed.
Well, let's delve deeper into the developing issue of COVID-19 and its impact on mental health. And to explore this topic, I'm joined via Zoom by a panel of professionals. Dr. Florence Baingana is joining us from Congo, Brazzaville. She's the Regional Advisor for Mental Health and Substance Abuse at the World Health Organization's Regional Office for Africa. Dr. Frank Njenga is joining us from Nairobi. He's the Presidential Advisor on Mental Health for Kenya. And Dr. Andrew Wu Yang Kim is a research fellow at the Massachusetts General Hospital and Harvard Medical School. He's also an honorary lecturer at the University of the Witwatersrand. He's joining us from Johannesburg. To you all, thank you and welcome to the program. Now, I want to get your perspective on the mental health situation, particularly in Africa, and as a result of the ongoing pandemic. There seems to be evidence that COVID-19 may have triggered a spike in mental health problems in Africa and globally. In fact, analysts are suggesting that these issues could be stemming from the economic and the social effects of the pandemic. Dr. Baingana, what is the statistic showing? What is the data showing?
Well, it's very difficult to get data for the sub-Saharan African region. But we do have data, a very little from mainly South Africa. So maybe Dr. Kim will be able to provide us more data on that. But from other parts of the world, there's evidence that anxiety and depression have increased, and the rates differ. So a person who is quarantined will have higher rates of anxiety and depression compared to somebody who is not quarantined. So as an example, you may have 6.7% of people who have not been quarantined having anxiety, whereas a person in quarantine will be about 12.9%. Then we have COVID patients, up to 35% of them have anxiety, and 20% of them have depression. So these are some of the data that we have. We also have people with healthcare workers and other responders also having increased rates of anxiety, of depression, alcohol and drug use disorders. So that's some of the data that we have, not from Africa, from other parts of the world.
So let me get your perspective, Dr. Kim, because you've researched extensively on the mental health situation, particularly in Soweto, in South Africa. What are your findings, and what's been the severest impact for South Africa?
Yeah, thanks so much for having me. So I just want to set the scene a little bit, because I think it's important to understand what mental health was like even before the pandemic. And the larger story that I think you'll hear from all of us is that, mental health was not great in the beginning and is really only going to get worse throughout the COVID-19 pandemic. So in South Africa, based on the most recent nationally representative study of mental health, about a third of individuals experience a mental illness sometime in their life, and about half are at risk of developing a mental illness in the future. A quarter of cases are considered to be severe, but only a quarter of those cases actually receive treatment, meaning that 75% of individuals actually don't receive treatment who have severe mental illnesses. And as you can see, there's an incredible amount of burden, psychiatric burden in the country. Unfortunately, this is met with limited public mental health care systems and high rates of stigma. So all this together, the data show that the mental health care system is overburdened and under-resourced. Right. Now comes COVID-19 in South Africa, and we see that these mental health care issues and mental health disparities are only starting to exacerbate. So in our research, we find that greater levels of perceived COVID-19 related risk, so greater levels of perceived risk of getting COVID-19, are strongly associated and predictive of worse depressive symptoms, or expressing worse depressive symptoms cross-sectionally. And we also see that in addition to this, that this relationship is worse among individuals who have greater levels of childhood trauma. Now, among the people in our sample, these individuals, many of whom were growing up during the apartheid regime in South Africa, or the racialized system of inequality affecting communities of color. So there's really these compounding historical issues of living through apartheid, along with the COVID-19 pandemic, and many other sources of trauma and adversity, of course, that people have experienced throughout that process.
So I want to get, I want to jump in here, Dr. Kim, and get the perspective of Dr. Njenga, because you're an advisor for mental health issues in Kenya, and you've been a practicing psychiatrist for a long time. Looking at the statistics before and before the pandemic, and what is happening now during the pandemic, how is mental health deteriorating, manifesting itself, particularly during this COVID-19 period?
Two things. One, that I think it was the 15th of May last year, the World Health Organization, right at the beginning of the pandemic, actually warned us and released a report that predicted exactly what Florence has just said, that there would be an increase in mental disorders and specifically around anxiety, depression, substance use disorders, and that sort of thing. And in fact, that report, if I remember it, I think it came from the UN, indicated that as we flatten the curve of infections, we must anticipate the need and requirement of flattening the curve for the surge that would come with mental health needs. And that's exactly what has happened, and I can say that confidently about that in this part of the world. And the origin of this, very interesting, is twofold. The first reason we have alluded to, and is to do with all the measures we had to take to stop the virus spreading, number one, locking up and the economic consequences and pressures on families and so on. But that's one side of the equation. The other equally important side of the equation, and this is a data that is coming up relatively recently, is that even mild infections with the virus themselves lead to mental health consequences. So it's not what we thought previously about long COVID,
Right.
about people who had severe infections. It's anybody who gets infected with the virus, get into the kind of mental health needs that Florence has just talked about.
So let's talk about those mental health needs, Dr. Njenga. And I do want to find out exactly how much Africa was concerned about mental health needs on the continent versus how the continent is reacting now to our mental health needs.
A bit like Dr. Kim, I think you need to understand context. You need to understand that even before this pandemic, Kenya started preparing for the big increase in mental health needs that we had identified. The president in June 2019 declared a red line in our country that said enough is enough and we must do something about it. The government put in place a task force, which by the grace of God I happen to chair, which examined the burden of mental disorders in our country. We made a report on that to government on the 7th of July last year. And we have launched the mental health action plan for the next 5 years on the intervention for our country to respond to this humongous problem. Now, much as the COVID situation is a serious negative problem to us, we see an important silver lining in our country anyway,
right?
Because more and more people are able to come forward and declare themselves as needing mental health services, attributing that need to COVID and so on. So I think, speaking only for Kenya, we kind of were anticipating, we are prepared, and we have launched the action plan just today, actually.
All right, Dr. Baingana, let me get that from you as well, because the World Health Assembly in May recommended a reinforcement of resources to protect mental health during public health emergencies. And Dr. Njenga has talked about exactly what Kenya has put in place and how Kenya has realized the need for that mental health facility to be made available. Why is it important, though, to consider mental health at this time? And how much importance are sub-Saharan African countries now giving as a priority to issues of mental health?
Sub-Saharan African countries recognize the importance of mental health, and the regional office recognizes this, and that's why we have this position at the regional office. At the same time, we must recognize that WHO Afro has to deal with a whole lot of problems, and the governments themselves are dealing with so many other competing priorities. These would include the communicable disorders, which are not going down, and the targets that we have set may actually go backwards because of COVID. But recognizing all that, WHO is doing the very best that it can to provide support to countries to support them in developing policies and plans. Dr. Njenga mentioned I believe it was Dr. Njenga who mentioned the WHO Assembly document, which endorsed the Global Mental Health Action Plan extension. Right. It was to end in 2020. It's now been extended to end in 2030. This happened just recently in May. At the same time, in the same WHA assembly, in the same assembly in May, we also endorsed the strengthening of mental health and psychosocial support as a response to emergencies, not just to COVID. This was a huge, really a huge step forward, because mental health in the past has not been included within the discussions of emergency preparedness, in the international health regulations discussions. Right. And so this is the first time we are discussing it, and it's been endorsed. And so now we call on countries, we also call on WHO and the partners to the countries and to WHO to allocate the resources necessary to ensure that we are able to fulfill these obligations that the countries themselves have actually endorsed.
All right, we'll leave it there for the moment, but for now, we'll take a short break. To stay tuned.
But now people are definitely talking about it more than they ever used to. So it's not as much of a taboo subject, but I still think that people see you with more empathy, and I think that you're still perceived to have a weakness rather than a mental health issue.
What I'm thinking is that the government must invest in rehabilitation, professional psychosocial support and counseling, so that we can do away with the negative effects of COVID-19.
I have a friend who was very stressed after the government imposed a partial lockdown last year. Just from looking at his facial expressions, one could tell that he was in fear of what would unfold. When he shared his fears with me, I advised him to stay positive and only follow official information.
My son got infected with COVID-19. It was a very bad experience. His father and I cried every day as his situation seemed to only getting worse. His symptoms were severe and he felt the death was near. Even now after he recovered, he's not yet back to his normal mental status. He has no appetite for life. COVID-19 destroyed our lives.
Well, more views there from a cross-section of Africans on mental well-being in times of COVID-19. Welcome back to the program. Let's continue this discussion with Dr. Florence Baigana, Dr. Kim, and Dr. Frank Njenga still with us on the program. I'd like to hear from you and some solutions to the current problem. What would be your advice to viewers who may be taking care of their own mental well-being, taking care of, at the community level, at the family level, and at the national level? What would be your advice? Dr. Njenga, you go first.
Yeah. Oh, Dr. Kim wanted to go first.
All right, Dr. Kim, go ahead.
Sure, yeah. No, I think this is extremely important. I think Dr. Baingana brought up a lot of really important initiatives that are ongoing right now, such as the issue of integrating mental health care service in primary healthcare settings, but also advocating for universal healthcare coverage, which is something that South Africa is trying to explore right now with the NHI. Also, trying to increase better access to lay psychosocial resources, whether that's through task sharing or through training community healthcare workers, and even utilizing these really underappreciated community-based resources, such as support groups or churches or other community centers, which are really culturally salient resources for promoting mental health and well-being. In addition to this, I think it's really important to think about, what mental health care could look like, or promoting mental health and well-being in the workplace could look like. We did a recent study with the South African Depression and Anxiety Group, which is the country's largest mental health NGO, and also running the country's largest call center. And we did a survey of 194 different NGOs in the country, and found a really astonishing rate of psychiatric morbidity at the level of similar to refugees in other contexts, as well as peacekeepers. And some of these recommendations that we've put forward were, of course, to provide immediate mental health resources within the NGO, whether that meant even just a simple debrief, or referrals to outside, managing expectations and clarifying roles, especially for caregivers or NGO workers who are really constantly providing assistance to people in need, and really paying extra attention to people's workload, how much they're providing, especially because I think for a lot of us these issues can really be something that we work on for a really long time, especially because the need is so high.
All right. Dr. Njenga, in terms of communities and governments responding better to issues of mental health, what would be your advice?
I think in the case of Kenya, in a sense, we are lucky in the sense that we started off by putting out a task force that traversed the entire country. And again, I'm happy to share the report of the task force, because not only were we able to identify the regional peculiarities of need, we were also able to identify the sectoral needs of the different segments. And the demand that has been made of us in government now is that we must now respond in a multi-sectoral manner, critical of which is the educational system. And one of the things that we are actively doing now is developing a curriculum for teachers and parents to help them in the early identification of mental health needs in children. We are also working with faith-based organizations, which very interestingly came out to us and said, we are the first stop of human beings in emotional and psychological needs, and yet we do not have the equipment to respond to that need. And they have demanded, in fact, of us that we give them a curriculum that will enable them to respond to this need. First responded, the police, the army, the ambulance people, were another group that came to us, and so on. So in that sense, we're reasonably well in that we know the needs of the people of Kenya and are responding to them.
All right. So I want to get a final thought from all of you. Dr. Baigana, I'll go with you first, because a return to normalcy is now being granted virtually by vaccination. And that may offer, some hope into returning to some semblance of normalcy. But what are your thoughts and your lasting solutions that you would propose in dealing with the long-term solutions and the crisis of mental health?
I think my parting thought is about the individual, and the individual having power over their own mental well-being. So my parting thought is everybody should get vaccinated, because that will allay some of the anxiety about getting a severe illness. Those who are vaccinated, the illness is not as severe and the death rates are much, much lower. I also encourage people to keep a tab on their moods, on their feelings, on their aches and pains. If they are not feeling well, they are feeling tired, each person should take time to rest and relax, avoid excessive consumption of alcohol. I would not encourage people to drink alone. So try and drink with others, but don't drink alone, because that tends to lead to drinking too much. And we also have some resources on the WHO website. For My Hero Is You is a book which has been translated into very, very many languages that are going to help parents talk to their children about the emotions, about the feelings, about what's going on right now. We also have psychological first aid. We have basic psychosocial skills. People could also think about taking up walking regularly, taking up yoga, taking up meditation. I think these are also important. As much as the government can do a lot for you in the area of mental health, it starts with you, the individual.
All right, Dr. Kim, your thoughts?
Sure, yeah. There's just a number of things that I guess I want to mention that have different time scales. First, in addition to really just emphasizing the importance of integrating mental health in primary healthcare systems and increasing universal healthcare coverage, I think one thing that we didn't mention too much was around the importance of accessing different forms of care, especially through telepsychiatry or telehealth mechanisms, especially for those in rural areas or hard to reach communities. So that could be, something even through WhatsApp or text or phone, if technology allows, through a tablet or video. Another thing I think that's important is really trying to embrace the cultural pluralism or diverse cultural perspectives that come with mental health. Mental health is something that's, has so many different understandings and explanations, even within a small community. And I think really being able to understand and appreciate those perspectives and integrating those into interventions will really provide really large dividends. And I guess the last thing I'll want to say is I'm really just thinking about how mental health has played out in the past. What are these? How can we learn from lessons from the past? And what are these sort of larger historical and political structures that have precipitated and continue to exacerbate mental health inequities today? So thinking about legacies of apartheid, thinking of legacies of colonialism and imperialism, and really just trying to reflect on how those systems continue to produce mental health inequities and other forms of health and social inequities today in South Africa and in other contexts across the world.
Dr. Njenga, you have the final word.
Well, quick ones. The first one is that for me, COVID-19 is a crisis, but more importantly, is an opportunity. It's an opportunity because, as Dr. Kim has said, we have embraced telepsychiatry completely and have just submitted a paper on telepsychiatry practices in our country because we were able in April last year to license the practice of telemedicine actually in our country. And we have shown that it is acceptable and it is effective, particularly in the delivery of mental health. Secondly, we have, during this crisis of COVID-19, again submitted another paper on the power of social media as an agent of change and transforming the way people understand and consume. So we have been able to adapt to the changing environment created by COVID-19. And finally, and I speak now to what Florence has said about vaccination, I would urge that medical workers, in particular doctors, that we really lead in this battle by example and by talking about it in an environment such as this one. Many thanks.
All right. Thank you very much indeed for such a lively discussion. But we'll leave it there for the moment. And that's all we have time for this week on the program. A big thank you to our guests for their insights. Dr. Florence Baigana in Brazzaville. She's the Regional Advisor for Mental Health and Substance Abuse at the World Health Organization's Regional Office for Africa. Dr. Frank Njenga in Nairobi, the Presidential Advisor on Mental Health in the Republic of Kenya, and Dr. Andrew Woo Young Kim, a research fellow at the Massachusetts General Hospital and Harvard Medical School, and also an honorary lecturer at the University of the Witwatersrand in Johannesburg. And thank you to everybody for tuning in to this week's discussion. The conversation continues online through our social media handles on Twitter, Facebook, and YouTube. And see you again next week. From the team in Nairobi, I'm Beatrice Marshall. Goodbye.